Hey everybody, welcome to In the Know with Nina. I'm your host, Dr. Nina Crowley. I'm the Director for Clinical Thought Leadership and Partnerships at SICA, where we partner with healthcare providers to offer body composition solutions. Today I'm joined by Dr. Nisha Patel. She's an obesity and metabolic health specialist. She's actually like six different things, making up a really cool version of cardiometabolic health. And I'm really excited to have you. And I'll let you tell us a little bit about your background because I think it's a really unique combination. There's probably no one else with all of those.
I mean, it's like really interesting how I landed here. When I had graduated residency, I thought I was gonna like work for a year and then apply to fellowship and become an oncologist, which is like completely the opposite of where I am right now. But it became pretty clear I didn't want to do that. And as time went on, I really, I worked in the inpatient side. And so I took care of patients that were hospitalized, that were really sick. And I started just feeling this uneasiness of like, this is really meaningful work and it's important work, but this is not entirely the work that I envisioned myself doing. I really wanted people to, live their happiest, healthiest life and focus on prevention. And so, piece by piece, put together what I call a cardiometabolic health specialty, although that specialty is starting to kind of take flight, but that wasn't something that was around when I was in training. And so my background is internal medicine. That's my residency program, but I went on to do an obesity certification, menopause, culinary medicine, clinical epidemiology, and did a cardiometabolic health certification. And still working on some others because I think that there's just more, more that I want to learn and more that I want to help patients with improving their lives. So yeah, it's a little unconventional and not traditional, but it's been incredibly fun, and it's so nice to like align your values and your purpose with your work. I think that doesn't always happen for people, and I'm just so
Oh,
grateful.
absolutely. I feel that way completely. It's a funny road that brings you here, but when you do feel aligned with everything, it's a lovely place to be. And I will say, following you on social media, I feel like that comes through in a lot of your posts too. So that's always nice too when you can really operate out of a place of authenticity.
Yes, I am. I always tell patients and people like I'm just real. We live in the real world, and there's like perfect and ideal, and then there's reality. And if you live in the perfect and ideal, that's not really translatable to like everybody in the real world. We have our challenges. There's a lot of those challenges out there, and we have to learn how to like work around those and help patients and people live better lives in whatever capacity they can.
For sure. Well, that does kind of transition to what, I wanted us to continue a conversation that I started earlier with Disha. And I
Yes.
know I met you guys together and you guys kind of traveled together. So I love that.
Yeah.
Um, and we started talking a good bit about sort of women's health and hormones and she's got a similar background but also in endocrinology, so we dove a little deep into the hormone side of that conversation. And actually what I thought we could talk about today was a little bit more about sort of the patients that you work with and how you're able to help transition them or translate the science into daily food and lifestyle and behavioral choices. I know you've also got culinary background, and so I'm sure that finds its way into your practice as well.
Yeah.
So yeah, so let's maybe dive in a little bit to just actually maybe tell me first about what kind of patients you're seeing. What do they come to you for? Because I'm sure it's tough to translate all of those specialties into your patient sort of introductions too.
Yeah, and I also see a pretty unique patient population compared to some of the obesity and metabolic health practices out there. So my practice, I always say, is like seeing the sick of the sickest patients. Unfortunately, I mean, these are patients that are undergoing transplant evaluation. They're after transplant. They have end organ failure or damage. So people with kidney failure, liver failure, heart failure. I also see non end organ failure patients too. I see, you know, 20 something year olds with PCOS. So it's like I really get this like full breadth of like exposure to patients, and it's been incredibly rewarding and also like challenging in the same time, which is not a bad thing. Learning how to apply these techniques to patients and apply these strategies to patients that haven't been studied in clinical trials, especially when we're talking about medication management. And so it really truly is like evidence-based personalized care, because when you don't have the randomized control data, of using certain therapies and certain populations, you're really trying to take the best level of evidence and then understanding the person in front of you and like what they are and are not capable of doing, which I think is incredibly important and
Mm.
crucial, and oftentimes like not like is missing from the conversations around health. People always want kind of like the like tell me what I need to do exactly the way I need to do it, and it's like, well, it's not that simple, because I'm not living in your shoes. Like, I don't walk through your front door. I don't know what's in your kitchen. I don't know what you have access to. I don't know what your job's like. Like, that's something that and we have to make sure that I understand that when we're talking about coming up with a plan together.
Absolutely. That patient, I mean, the patient-centered, personalized approach, we hear that a lot even as buzzwords, but I know you're also living in kind of a social media space where
Mhm.
people want it even more distilled than that, right? Like they just want that simple one-liner, even though we know there's so much nuance and backstory. And like you said, I'm not walking through your front door. I like that phrase.
Yeah.
So, how do you approach patients then? How do you get to that place when they're coming at you, even or on social media? Like how do we get to the nuanced messaging that we really need to actually move the needle on behavior change?
Yeah, I always say nuance isn't sexy, but it's what works. It's not something that like nobody wants to hear like it depends, or like it could be this way or this way, because it doesn't give them that like frame, like that rigid framework that maybe people were used to in the past, right? Whatever they encounter. For example, there was a lot of rigidity around dieting and diet culture back in the day, and I'm not saying that's gone away, but I think there's more awareness around that and how maladaptive that can be. But people come to me and they'll say, "What's the best diet that I should be on to lose weight?" For example, and I'm like, "Well, you're probably not gonna like my answer, but it's the one that works for you in the long term, right? Because if it's something that they can't do for more than 6 months, um, it's not really going to help." And so I think that having that conversation and level setting too, helping them understand, helping them maybe think differently about their thought processes around, for example, lifestyle habits or behavioral strategies for whatever we're trying to treat, is helpful. And then I do a lot of myth busting in my clinic too. Patients will come to me and say, I've had several recently that said, I read online that my diabetes is caused by parasites. And I was like, okay, where did you read that? Like, what are your thoughts? Like, it's never like me. I would never blame my patients or anyone for trying to understand like why certain things are happening to them. My frustration is more with the people that are sending that messaging, because I think that a lot of times it's kind of done with an ulterior motive. You want to sell a quick fix or a quote unquote parasite cleanse. And even when I ask patients, I'm like, oh, when you saw that ad, was there some sort of like product associated with it? You know, and of course, they're most of the time they say yes. And patients understand that. They're very reasonable. You can't assume your patients don't get it. Of course they get it. Like, they're out there living their lives and they're being exposed to this stuff. So it's important to level set and then explain why kind of cookie cutter extremist messaging often doesn't work for people, and then really looking at their lives. I mean, this is where I spend the bulk of my attention. It's not just about their medical history or their medications or their drug allergies. It's like, okay, who do you live with? Who supports you? What do you do when you feel stressed? Like, what's your day-to-day physical activity look like? What um, of course, we talk about eating patterns and all of that. What makes it harder? What makes it easier? Like, those are all things that are not going to come up, in a one liner that somebody's trying to like put out there. And it's important to have those conversations. It's work worth doing. If we don't do it, then we're just doing a disservice to people.
Yeah, and people do come with such a shame too, where like they've not done it right, and they because they've maybe tried and failed a bunch of things over the period of time, they come feeling like, all right, I don't trust myself. I need you to tell me what to do. I mean, that was
Yeah.
in the number one thing. I worked in bariatric surgery for years as a dietitian. And that was the number one thing is, listen, I've tried this before. I know, I know this, but it's not working, and tell me that, you have the answer, that you can help me. And it's hard work getting them back to themselves and trying to figure out, what works for them. But we know, doing this work, I think, especially with all of your, different areas, like doing that is what's sustainable, right? So anything can change probably your weight for a short period of time, or, even your biochemical parameters even. But we're most interested in how we can help someone make these long-term changes to affect all of those cardiometabolic outcomes, right?
Yeah, and I think one thing that's helpful for patients is like reminding them. For example, I get patients that come in and they'll say, X, Y, and Z worked for me when I was in my 20s, and now I'm in my 40s and it's not working. And I was like, well, you were in your totally different situation in your 20s. You're like trying to apply something that worked for you in a totally different situation to your current situation. Now you have 3 kids and a full-time job and 2 dogs, and like, it's not going to work. You probably had more time when you were in your 20s. And so trying to really help them understand that is important, because comparison is the thief of joy. And I think a lot of people all, compare past attempts. Example, for weight loss, they're like, I lost 30 pounds doing X, Y, and Z, and I can't do it anymore. And it's really helping try to bring that to awareness for them, not in a judgmental way, but just to help them understand that, look, it's a different time. You don't have like an abundance of time or energy. And even if somebody did, like, even if you had 5 hours in the day to like meal prep and exercise and whatever, I mean, there's still going to be people that struggle with their weight, because we know that there's a biological underpinning there, and you can't, like, that's what it is. And it sucks. I'm not saying that to be defeatist, but I'm just saying that's an understanding of like the baseline risk. And then, yes, if there are people out there with abundance of time and energy. I mean, I see patients from all backgrounds. It's not like there's only one subset that's struggling with their weight. I mean, it doesn't matter. Like, there's people with like tons of resources, and there's people with very little resources, and they're all struggling in their own way. So it's just, I mean, it's not always enough to just say like, try harder.
Right. It's funny. I used to always say, years ago, I used to always say, listen, if Oprah is struggling with her weight, it is
Yeah.
not a class and status thing, right? Because she
Yeah.
has the finances to pay all
Oh,
the
yeah.
people to do all the things. And so interesting timing, because she just came out with a book that I haven't picked up yet, but I do understand it's a lot. It's got a lot of these messages around the shame and all of that we felt from years of diet culture, and people, thinking that it was just willpower or
Willpower.
just
Yeah.
a personal
Try harder.
failure.
Yeah.
Try harder. And examples of people all over who are just, this worked for me, do what I do. And I think that's actually an interesting part, because in the social media sphere, it's so visual, right? There's such a tendency, I think, for us to say, well, this person looks good and I want to look like them. So I'm going to follow what they do and find out what they do and just, do that thing. I think there's so much to unpack there, and why we would follow that rather than the evidence. I mean, I grapple with this all the time. Why are people following one famous person, one, influencer, when there's decades of research pointing us in a different direction? How do you reconcile that?
Yeah, and that drives me insane when I see that, because I'm like, okay, it worked for you, great. But again, your circumstances are different from like the person that's trying to emulate you. Like, for example, one of the things that since becoming a mom, it became clear to me that, time is super precious. And if I didn't have the help that I did, I wouldn't be able to do the things that I do. And you can't assume that every single woman out there that's in a similar situation has those resources. I mean, that's not the reality that we're living in. And so it just, always drives me crazy when people say, oh, well, this person did it, I can do it too. But you're like, no, but you don't see the external factors. Maybe they have a nanny. Maybe somebody comes and cleans their house. Maybe they get grocery delivery. Maybe they have a supportive spouse that will watch the kids when they're, exercising or whatever. Maybe they don't have to worry about finances. Like you just don't know. And it just drives me nuts because and again, it's not the person that's seeking that care. It's just like that messaging that's coming from the other end where it's like, you should just do what I do because if I did it, you can do it too. And it's like, well, no,
And
that's not true.
that also generally comes with a, and here's my program that you can do it, or,
Sign up
with,
for my 12-week program. Yeah.
yeah, and even with supplements and hormones, and we're seeing even so many more of these sort of peptides that are, not being well described what they really are by, by different folks. And so I feel like as a consumer, it's gotten absolutely harder these
Calming.
days with
Yeah.
like, but it shows us how more information and education doesn't equal behavior change, because we've got plenty of information out there,
Oh
and we're
yeah.
mostly all still struggling with implementing that into our daily behavior.
Yeah, it's not an education or implementation problem. Yes, there are some things that we can educate others about. Like, some of my patients don't realize that. Like, I had a patient the other day that was eating a certain brand of protein, and they didn't realize, not protein, yogurt. They didn't realize there was like very little protein in that specific brand, and they were able to switch to a brand that was contained more protein and met their goals. And so, yes, those are opportunities to educate. But then, you're getting into like the nuances or the weeds a little bit there too, right? Because you're talking about like that's like when you're showing them the practical like strategy of like if you switch from this brand to this brand that you can hopefully afford, then it's gonna be better for you. It's just like those conversations don't happen. It's like, hey, buy my protein powder that's $50, and it'll last you 2 weeks. And again, nothing wrong with protein powders or anything. I'm not trying to demonize any specific ingredient or food or anything. It's just more about the messaging and how people perceive it. And it's overwhelming. I mean, like, there's just so much coming at patients. And I'm glad that I can be a source for my own patients and say, you can eat blueberries. I promise you they're not toxic unless you're allergic to them. There's people that will be like, oh, I saw that somebody was saying that blueberries were toxic and I was like, oh my gosh, it's blueberries. It's not like arsenic, in like toxic doses. So it's nuts. And I can't imagine like trying to navigate all of that on top of everything else that's going on in life. Like, I understand why people want more straightforward messaging, perhaps, or I'm not going to say quick fixes, but like something along the lines of that, because they just don't have time to sit there and dig and decipher and read. And it's some people might, but most people don't.
It is a tough balance then between, what is the simple tweaks that you can do and what's oversimplifying, because there's danger in that. We've heard that messaging for so long, that just sort of, eat less, exercise more. I think these days we've translated eat less into, eat more protein, and exercise more is more now like just lift weights. And so that tends to be kind of this, blanket advice that people like to give. And I know, we talk about sort of the midlife, and we're there as as moms, and as working professionals, right? But I think that this midlife, premenopause, perimenopause, menopause transition time, has been a really interesting, I almost want to say new area, because it's not
Mhm. It's
new, it's always been there, but there's sort
always
of
been
new
there, but
attention,
more
right?
awareness.
There's
Yeah.
more awareness. I know there's been some, research that has kind of been unearthed that was sort of, they were getting it wrong, and hormone replacement was sort of buried for a while. And but I do think this kind of midlife season for women in particular just tends to be really tough, because you just very well described all of these external factors that make it tricky.
Hmm.
But we've
Hmm.
also at the same time got like physiological changes to our
Changes.
body that are happening, good, bad, whatever, they're happening, and people may not like that. And so I thought maybe you could talk a little bit about, how do you talk to patients about that? How do you, normalize what's happening, but also understand that they may want to change it from a patient-centered approach?
Yeah, I think first off, validating that their experience is real, right? I think a lot of the conversations around menopause in the past, well, first off, I don't think there were many conversations from between families, generations, because I think most of us, like I don't even know when my mom went into menopause until like I had to ask her. Um, and my grandma, like she didn't, it's not like she talked about it to my mom. So those conversations didn't exist. It was kind of like you suffered in silence and got over it, and then all of a sudden stopped having periods and couldn't have any more babies. Um, so I think validating that the experience is real. It's not like you're not making it up in your head. Like the hormonal changes and how they impact your health are just wild. I mean, I'm definitely in a kind of earlier, like for example, in pregnancy, I wasn't prepared for like just how intense it was going to be. And it really humbles you because you're like, wow, these hormones, they are something else. And then you're going through menopause and it's like, oh no, that's another transition that I'm experiencing, because women go, like, I know Disha always says this too, but like women go through different life stages every 5 to 10 years depending on what they're doing or what their goals are. um, and it's not easy to do that. So first, validating that that is happening and that there are intrinsic and extrinsic factors that are impacting their overall health, right? It's not just, oh, it's just you're so stressed and anxious, calm down, or like maybe you should sleep more. And it's like, well, I can't sleep because I'm having hot flashes. So again, we have to address both of those. I think a lot of women internalize these symptoms and feelings that they're having about this transition. I think a lot of women have been made to think it's all in their head, or they're just making a big deal out of nothing. When in reality, they're going through something so tumultuous and unknown. Like, we don't know how long the transition lasts for every single person. Like, we have averages, but everyone's experience is unique. So really helping people understand that it's not just one thing that's happening, there's multiple things. And then you start tackling what you can control. We can't really control maybe the age of when we start to transition to menopause or perimenopause, that period. But can we help with your symptoms? Can we work on your sleep? Can we help you eat as healthy as possible? Can we help you get, help for some of the things that you're struggling with, the stressors? And it's not all something that like a health system per se has a one-stop shop. Although I think there's a lot of interest in, making these specialized clinics to really kind of globally address the midlife for women, but we're not there yet. And I think a lot of, again, messaging in the menopause sphere is, there's a lot of like strong messaging around specific interventions or specific things that people can do. And again, I'm so glad that more and more women are reaching out and getting menopausal hormone therapy, which is also known as hormone replacement therapy. Replacement is a misnomer. We're not trying to replace premenopausal levels of hormones. We're trying to manage symptoms and improve quality of life. Um, but it's still, there's still many that are suffering out there. And I know, like, amongst my colleagues that have transitioned or transitioning, I mean, it's tough, right? They're in the workplace, they're in these high impact jobs, and they're also going through something internally, and people don't really get it. And it's not like they're looking for sympathy, but it's just understanding that, like, okay, these things are happening, and I do need to get some help for it, and I'm not going nuts. I think that in and of itself is important for us to convey.
Yeah, and we talk a lot about sort of the changes even in body composition during that time that are just so they're so interesting. And even if you take weight out of the equation, which more and more we're doing, we're putting less of a focus on that. We're still seeing sort of this simultaneous decrease in muscle mass each decade as we get older, and an increase in visceral fat for a period of time, and that does not sort of jive with cultural, you know, ideals for women in our 40s or 50s, and so that's a tough one, even knowing that it's normalized, right? So then, but then what if, and if your patients are coming to you asking for help and change beyond the hormonal therapy, I know for you, seeing a lot of patients in obesity management and weight management, you're able to help them with that part of the equation too. But
Yes.
how do
Yeah.
those conversations go? How do you figure out what
Yeah.
to start first or where to tackle?
Yeah. It's got to be a stepwise approach. I think that one thing that I always want to make sure that women understand when they're going through this transition is that, yes, I totally get like there are changes in your body composition, and you know those unfortunately are going to lead to higher risk of developing certain health outcomes. And we actually talk about those health outcomes. It's insulin resistance and risk of diabetes, it's high blood pressure, it's high heart disease risk, it's cholesterol going up, it's all of these things. And so really trying to bring it home that yes, we don't want to just like talk about the physical aspects of it, which I can understand why they're distressing. Because again, women will say, I've done nothing different. I have no idea why I am gaining more weight around my abdomen right now. It is happening. And I was like, I believe you. And it's multifactorial. And we should also, talk about addressing that and all of these other factors. I think if people are candidates for menopausal hormone therapy, by all means, like it's worth definitely trying. I think there's, lots of different individuals out there that can prescribe it, primary care, OBs, even some obesity medicine specialists, endocrinologists, making sure that they have access to that care. And then talking about like, okay, there's this transition and it's not 100% in your control. Like you can't, I wish I could tell my body to stop, but it won't. But what can we do about it? What can you do about it in the confines of your resources and time, um, and help people not feel like it's completely hopeless. And I don't even want to use the word feel, because it's not. We can do things. We can help people improve their health, but part of it is empowering women to come and ask for those things, because I think again, a lot of women out there are just suffering in silence and they don't know how to advocate for themselves in this system. And I'm a doctor that works in the system. It's not perfect. It's not. I think every female healthcare provider can talk about a situation where they didn't feel like their concerns were heard. And so what would happen to our patients, right? Like what's happening to our patients. And so it's important to really think about that and help women advocate for themselves. And even if I don't have the answers, like I make referrals all the time, um, so that people can get the help that they need. I really like to keep the conversation health focused, because I know that again, a lot of conversations around weight are about appearance, or like I want to get back to, I mean, no one really says they want to get back to their high school weight, because I don't think most of us are at our high school weight or
I
ever
hear
going to get
people
back
say
there.
it. I used to hear
Yeah.
people say that a lot. Yeah.
Yeah. I always tell my, well, and I guess I'm more proactive in saying, the goal is not to get to your high school weight, because again, you were younger, different situation. And I think that helps people understand, and come around and really view their health in a different lens than what they've maybe grown up hearing from family or society or friends or whatever. Really want to keep it health and quality of life focused. When I meet a patient, I'm like, I do this work to help people live their happiest, healthiest life. So I'd love to get to know you better, get to know your journey, and then let's see how we can work together. That's like a common line. If any of my patients are listening, you've heard me say that, because I mean it. It's not just about like the number on the scale or hitting specific like numerical targets or getting to a normal BMI, which I hear that sometimes, and I'm like, cringe, because it's
Totally.
just that's what people have been told.
Yeah. Yeah.
Yeah,
And that's what they're seeing as, I think there's also this unrealistic view that even that the non-medical or the non-medicine approaches are going to get them there. And so, I
yeah,
can tell that you're very patient centered, where you want to like listen to that person and help them there and not shame them for what they have heard or have tried or want to try. But it is hard because I mean, even just as a social media consumer, I often look at some of these supplements and alternative therapies. I'm like, well, I mean, I know there's not a lot of evidence there, but look, it looks like it's working for that person. Maybe I'll try it. I'm like, wait, and that's a tough one because we have a lot of education in that area. But again, education doesn't guarantee that you're not susceptible to just being targeted by really good marketing.
I think the one thing I always tell patients about supplements is like, look, they're not FDA approved. The onus of like safety and efficacy lands with the manufacturer. The FDA or DSHEA cannot like uh, they don't have the resources to go after and like test every supplement for purity and efficacy. And um, I always sometimes maybe on social media, if I come off anti-supplement, I'm not. I am supplement with a cause, right? Or for a reason. And within reason, because if you're going out and paying $500 a month for a supplement that I can't even tell you what's in it, like, yes, it says that on the bottle, but is that what's actually in it? I mean, that seems to me a little like, oh, it's expensive. And you have all these chronic medical conditions, these medications you're on that could interact with that supplement. And so we just want to be realistic about what we're trying to achieve here. I don't, I think if people are going to use supplements for whatever reason, obviously talk to your doctor, healthcare provider, want to use third party supplements that have been tested by some of these organizations like USP, NSF, I think is another one. So like what's on the bottle is actually what's
Right.
in the supplement. Um, and just, having candid conversations about expectations, right? At worst, there probably isn't going to be an impact on your health for things that are like low risk. And at best, you may feel a little bit better. And that's okay, right? We just want to be like very cognizant about like what people are using, why they're using it, is it affordable? Because I've had patients bring like bags of supplements to me, and I'm like, oh my lord, like they're like, oh, my nutritionist gave me these 15 bottles, and I'm like, do you know why you're taking all of this? And oftentimes they're not able to tell me. Like maybe they can name a few of them, and again, not their fault because this person like sold them all this stuff.
Right.
And I mean, they didn't walk away knowing why they were taking something. I mean, I tell patients like at the end of our conversation, if you tell me you have no more questions left, I did my job.
It's a
Clearly that
good.
didn't happen. Yeah. Clearly that didn't happen for whenever that supplement person was. But it's scary because this, particular these certain patients are on medications that have very narrow therapeutic indexes, and like, there's definitely room for harm there. And it's it's having a conversation that's very open and not judgmental and saying, look, I understand you want to feel better. Here's why I personally wouldn't recommend some of these supplements. And it's not like we can do it always in one visit. I'll tell patients I'll get back to them, or if they don't know, they can send me a list and like we can talk about it at our next appointment. But it's just being honest and open and not judging them, because I think people will hear sometimes from other providers like, why are you taking this crap, like that person's all.
Right.
And it's like, okay, we don't know the circumstances, and most likely that person just sold them a bunch of supplements and that's what it was. But again, the patient wants to feel better. At the end of the day, people want to feel better. And when they don't get the answers that they need from the healthcare system or conventional medicine, they're just trying to feel better and they want to
Mhm.
go out and look. And that's where this wellness industry, capitalizes on. It
It does.
capitalizes on the shortcomings of our medical system. And it frustrates me too. I'm a doctor in it. I'm a patient in it. Like I've had family members go through it. I've had family members not have optimal experiences. It sucks. It sucks. But because it sucks and I've experienced it and I know what it's like, that is something that I dig even deeper into, making sure that like none of my patients feel that way.
Mm. Well, and usually the promises from some of the less maybe effective or the less studied options out there, they're big promises.
Yeah, they're
They
very
address
promising.
some of these sort of hormonal non-specific complaints of fatigue and brain fog, and even some of the stuff that can be connected to maybe carrying excess body fat, that. So it's tough to kind of distill down, well, what is the symptom we're looking at, how are we measuring change in that symptom, because change in fatigue is a hard one, and
It is.
hard to measure in real time. And even just thinking back, well, I don't know, am I more tired this month than I was last month? That's hard to that's hard to pinpoint.
I think when people come to me with fatigue, you know, it's a symptom they're experiencing. It's often not from one thing, but I do think it's very reasonable to check kind of for certain medical conditions or deficiencies that could contribute. For example, iron deficiency anemia. Like it's very, unfortunately, more common than we think, and a lot of people are walking around with it, and they don't know. They're just like really freaking tired,
Right.
and they have they have the cognitive changes because again, you need iron to make red blood cells, and so it's important that we think about those things and not just say you have adrenal fatigue, your adrenal glands are completely pooped out, like I'm going to give you this supplement to like restart them. Like no, that is like then you're missing like everything else that it could possibly be, and that's just again a disservice to the person in front of you.
Right. I'm also always, I don't know if shocked is the right word, but interested to see how very anti-medication or anti-pharmaceutical medication some people can be, and at the same time be very open to taking handfuls of additional, pills that look the same, and really kind of a maybe miss or disunderstanding of what the active ingredients are and what really differentiates a medicine from a non-medicine. And I see that a lot in conversations around peptides versus like very GLP-1s are kind of understood to be a medication, but then there's all these sort of, well, it's like that and it's better than that and it's this, but it's not a medicine. And it's just always interesting because I feel when you're in the field and you know a bit about it, it seems pretty clear, but it's fuzzy and gray, and it's a gray area. And people like the idea of, I mean, even just this whole concept of micro dosing and being on the lowest effective dose. I guess that could be brought back to that there's shame in needing all the medicine for this big problem. And it seems like, well, if you only need a touch of it or just a little bit, then that could feel like it's you have less obesity or just a touch of it or something, right?
Yeah, I think part of it is like the appeal to nature fallacy for some of these things, like natural is always better. And then you totally hit on it. I think there's so much stigma around using medications to treat obesity or for weight management. I mean, our goal is to always keep our patients on the lowest dose that's working for them. But again, that lowest dose could be the highest dose that's working. Like it could be
Right.
because there's so much inter-individual variability in response. Like when patients ask me, like, where do most people start seeing a response? I can give them like just an average of like what my patients are seeing. But again, they may respond at the lowest doses and we may never have to go up. I have patients like that. And then I've had patients where like we've had to crank it all up to the highest dose. And then that's when they started seeing results. And it's not a failure. Like I just need people to understand that it's not a failure if you're at a higher dose of medication. It's it's just saying that, hey, your biology is different from somebody else.
Yeah,
It's not a failure.
that's a hard one to people don't you need to repeat that a lot. I feel like it's
Yeah.
almost I always picture from Good Will Hunting when Robin Williams is telling him it's not your fault, it's not your fault. But
It's
yeah,
not
he had
your
to
fault.
repeat it like 10 times for him to really start to
Yeah.
get emotional and understand it. Like it, I also think the more medications we see in the pipeline for weight management or even for the chronic disease associated with excess weight or adiposity,
Mhm.
the more different meds with different actions we see, the more it'll be understood that everybody might
Yeah.
need something different, right? Because when you've only had one or two, I think people tend to, I mean, even forming groups around that specific medication, it can get to be like almost like it was in bariatric surgery, people who were doing it's not necessarily just sleeve related or bypass related information, but the more meds we have in the pipeline, the more everybody that you talk to is going to be on something different, on a different dose. And then
Exactly.
maybe we can really start to see that the biology is the differentiator.
Yeah, and I think people don't say that about high blood pressure medications. I mean, we have a slew of blood pressure medications at different doses that people are on. Some people are on three, four, five medications, but it's not the same conversation as it is about weight and obesity. So
Yeah, it's always
very different.
that's always a good analogy. Yeah.
Yeah.
Okay, well, I wanted to ask you this, and then I know that we're running out of time, but I wanted to just ask, like, what do you see as the biggest kind of misconceptions or myths that you have to bust in your patients, whether it's, the hormonal um, or the weight management medications that you're working with them on.
Yeah, I think one of the biggest myths that I have to bust is that, with weight management medications is I could take it, lose the weight, and then like keep it off in the long term. And again, I go back to the high blood pressure analogy and the diabetes analogy and really help people understand that, look, these are therapies for a chronic medical condition. Most people are not going to be able to maintain their weight long term off of some dose of medication. Now, again, when you're in maintenance, like, do we try to lower the dose, keep you at the lowest dose that you are tolerating and has good efficacy for you, in addition to working on all the other things that are important? But it's like not an easy conversation for some people, because I think they come in like wanting a medication to lose the weight, and then they don't want to be on it forever. Going back to all that stigma about weight management and like just taking the quote unquote easy way out, which in reality it's not. Because again, nobody blinks an eye when it's like, I put you on lisinopril 20 for your blood pressure. It's just, but if you get on Zepbound 2.5 for starting a journey with obesity treatment, there's so much stigma, so much. But you got to let your patient come to you when they're ready. Like, you can't force things on them. Like, and that it's not like like some patients are like, I just want to try. I just want to like give lifestyle strategies a trial. And I was like, okay, let's try it for 3 months, 4 months, 6 months, within reason, as long as their health isn't going to, further deteriorate. And invariably, all those people do end up coming back and they're saying, hey, I'm ready. I'm ready to try a medication. But they
And
came up to that on their own terms.
yeah, and just knowing that it's not either or, right? I mean, I think that's such
Yeah,
a,
it's not either or. That is such a big message. Yeah.
yeah, just building that on those, building blocks of it's the
Yeah.
lifestyle, sometimes having to really unpack what that means to them. And yes, you're gonna, to optimize how you feel and how you are doing long term, you're gonna use all the strategies, right? So it's,
Absolutely.
yeah,
Can't
appreciate
pigeonhole
that.
ourselves into one thing. So, yeah.
Well, I feel like we talked about a lot of different things. This is a great conversation. I think, we've got to keep having conversations like this. I don't
Yes,
think
absolutely.
there's not an easy way to answer all of this too. So,
Yeah,
so thank you for that. And where can
absolutely.
folks connect or find you if they want to stay in
Yes.
touch?
I am on Instagram and X at Dr. Plantel. It's a play on my name, Dr. Patel, because one of my messages is eat more plants, because we just don't eat enough fruits and vegetables as a society. So you can find me there.
Awesome. Well, thank you so much for this conversation, and I know that we'll be talking again soon.
Yes. Thanks so much for having me, Nina.
All right. Bye bye.